Welcome to another session on our YouTube channel. Today we're going to be talking about neural mobility techniques. What is neural mobility? It's just a combination of movement of nerves amidst the mechanical interface where the nerve is. What do we mean by this? You know, the nerves in our body run from one spot to another, and at a time it is possible that there's compression on the nerves. It's also possible that we have injury that will result into inflammation and stiffness of the nerves. So the nerves is not able to move very well between the tissue where it is located. The fluids within the nerves and blood supply to the nerve is also affected. When the nerve gets stuck like this, it begins to fire abnormal impulses. That is when patients complain of pain from the neck going to the fingers, pain from the lower back going to the legs, with pins and needle sensation and all these sort of things. When our patients are down with this kind of symptoms, what do we do about it? Apart from the mobilization and manipulation that we have learned, we found out that moving a nerves to and fro at different points of the nerves could be a very effective manual therapy to resolve the symptoms that are associated with nerve compression. Right. Okay. We're going to be looking at median nerves. Median nerve is one of the nerves from brachial plexus that originated from the neck and passes through the axillars, exit from the axillars, and then it continues down on the medial palmar aspect of the hand. It's enter into the carpal tunnel. Exiting from the carpal tunnel, it sends its branches to the lateral 3.5 of the fingers. So it is possible that as a result of this inflammation, as a result of compression, as a result of accident, median nerve could get compressed, and then it begins to fire abnormal sensation and radiating pain. What do we do in terms of neurodynamics to resolve with these symptoms? We have to do median nerve gliding. So in median nerve gliding, the patient can be in a seated position with a proper spine, a little chest out, and then the shoulder will be abducted to 90 degrees. The elbow will also be flexed to 90 degrees, and the hand could make, the fingers will go into flexion while the wrist will be kept in a neutral position. Or if we're so desired, we can keep the fingers also to align the way we normally put our hands in anatomical position. So the sliding of the nerves is going to incorporate movement from the elbow, the wrist, and the neck. Right? So at a point, we're going to instruct the patient to extend the elbow and bend the neck to the opposite side. So in median nerve sliding or gliding, the movement of the hand and the neck take place in opposite direction. And when the patient is bringing the hands back, the neck is also coming back to do side flexion ipsilaterally. When the elbow is extended, wrist is extended, then the head do the side flexion contralaterally. Now, can you repeat series of that for us, please? Let's see. So the patient will hold each position for about 5 seconds, repeat and relax for about 5 times, and do 3 sets of that. And after that, we can reassess. So this is median nerve gliding.